Hello everyone and welcome to our Friday Lunch Bite, How to Help Kids Stop Bedwetting. We are recording this meeting today and we will probably see more people signing in, but we're going to go ahead and get started. This presentation was put together as part of a three-part series that we did on sleeping issues, on how to sleep better, and then also one of the things that happened is as the Center for Autism works with families on helping them with potty training and doing various methods and interventions for that. A lot of things that we found out for families are that they are having issues with nighttime bedwetting. So the reason we're doing this training is overall, children are being toilet trained an average of 2 years later than normal. So a lot of kids aren't getting toilet trained till about age 4 and 5 instead of around ages 2 to 3. And that also children who stay dry during the day are still bedwetting at night. And parents, again, have asked for assistance in how to address this. We have to make a disclaimer at this time. Any information that is presented today is not intended to replace a medical consultation. The information for further investigative methods will be noted. UCF CARD is not endorsing any alternative treatments that may be mentioned in the presentation, and parents are asked to use this presentation for information and to assist in determining possible reasons and treatment options for bedwetting. Nocturnal enuresis, otherwise known as bedwetting, is one of the many issues that kids with autism face. Kids can have other behaviors. And bedwetting may not seem much of a problem, but it really is. Many children with autism in general have trouble with nighttime bedwetting because they have difficulty in toilet training. By age 5, nighttime nocturnal enuresis or bedwetting still remains a problem for about 15% of children with Asperger's. So why the difficulty in toilet training? Well, there's a number of factors that are involved with that. Children on the spectrum are not typically good at imitation, which makes the process of potty training more difficult. A lot of times when working with families, some of the methodologies, some of the way that typical kids are learning to do potty training is they see other people in the family or other children, either in their classroom or at home, who are going potty, and those social cues and those different things are not being imitated and ingrained as part of the daily process for children, for all children on the spectrum. And some children and parents report to us as we're helping them with potty training is that their children don't even seem to feel that they're wet, their pull-ups, their underwear, or even that they've wet the bed. And that can complicate any training methods that you're trying to use to help them to overcome the bedwetting. Many of these children are also hypotonic, a condition which includes a lax form of muscle control, as well as a failure to respond or recognize the stimuli of the need to urinate. As we probably don't remember when we were children at the times when we started getting potty trained, but as our bladders matured and as we started to be able to have that recognition of a full bladder and what that feels like and the need to go, for many children, this is a condition that does affect them being able to prevent from either wetting pants or wetting the bed. So what are some causes for nocturnal enuresis? Most children with autism or ADHD are suffering from the same factors that cause bedwetting in other children, and those are small bladder capacity. So that would be your child's bladder may not have developed enough to hold urine that is produced during the night. Structural problem in the urinary tract or the nervous system. Rarely the enuresis is related to a defect in the youngster's neurological system or urinary system, but that can be a cause. Chronic constipation, so a lack of regular bowel movements, make it so your child's bladder can't hold so much urine and can cause the bedwetting. Diabetes. For children who are usually dry at night, nocturnal enuresis may be the first sign of diabetes. Other signs and symptoms may include passing large amount of urine at once, increased thirst, fatigue, weight loss, in spite of having a good appetite. The inability to recognize a full bladder. If the nerves that control the bladder are slow to mature, a full bladder may not awaken your child, and especially if your child is a deep sleeper. Sleep apnea. Sometimes nocturnal enuresis is a sign of obstructive sleep apnea, a condition in which the child's breathing is interrupted during sleep and often because of inflamed or enlarged tonsils or adenoids. Other symptoms of sleep apnea may include snoring, frequent ear and sinus infections, sore throats, and daytime drowsiness. Stress or stressful events, such as becoming a big brother or sister, starting a new school, sleeping away from home, may trigger bedwetting. And then urinary tract infections. A urinary tract infection can make it difficult for your child to control urination. Signs and symptoms may include bedwetting, daytime accidents, frequent urination, blood or pain during urination. So what the research has shown is that the majority of bedwetting is inherited, and that for 3 out of 4 kids, either a parent or a first-degree relative also wet the bed in childhood. Some scientists have even located some of the specific genes that lead to delayed nighttime bladder control. And for the record from the research from Bennett, they said that for those scientific folks, that they are on chromosome 13, 12, and 8. So in fact, many times when you all are trying to potty train kids or you're talking to family members, a lot of times you'll hear that, well, they'll say, well, your spouse, was a bedwetter, or they didn't get potty trained till a certain time and stuff. So those are important things. They may seem like they're negatives that you're hearing, great, well, I must be doing something wrong. But in fact, there can be some family history, and that is what the research is saying, is that there may be already a genetic reason of why your child might have the enuresis. So the risk factors for that is that it is more common if there is a family history, and it is more common in boys, and it is more common in children who have ADHD. So what are some of the complications of nocturnal enuresis or bedwetting? It's very frustrating, but without it actually, the reason being that there is a physical cause, it doesn't pose a health risk. But the self-esteem of the child can suffer. There also can be some rashes associated with wetness overnight, or some soreness or something. So you always want to be sure to have your child to bathe or to cleanse those areas each morning to prevent that. So when should you see a doctor about nocturnal enuresis? If a child begins to wet his or her pants during the day, or complains of burning or pain when urinating. If your child has swelling of feet or ankles. If they have to urinate frequently, if you see that they're eating or drinking more than they normally would, and also there can be some signs if you start to see some misbehavior or different behaviors at school or at home. If your child suddenly starts wetting the bed after they've been able to stay dry with no accidents for at least 6 months, you should consult with a doctor. Also, if your child is still wetting the bed after age 7, you should consult with a doctor. And if you're frustrated and you really feel that you could use some help, even if you're trying some different strategies and things, but it's not working, because there are some other methods and things that your doctor may suggest, such as a drinking protocol and working on helping the child to identify when their bladder is full and when they're getting those feelings, might be something that the doctor might recommend. So preparing for going to the doctor, understand that your first contact may be with your child's pediatrician, but you will probably be referred to a specialist. When you're going to the doctor, be sure you bring a list of all medications, vitamins, supplements, anything that your child is taking. You should write down any symptoms, such as note that your child does not seem to demonstrate that the feeling that they need to go to the bathroom. Sometimes you're pointing out, hey, they may be standing there wetting themselves and they don't even realize it. Or they're having accidents. And how much do they drink liquids before bed, and how soon before they go to bed? Sometimes that can be a cause of, not a medical cause of bedwetting, but an actual cause is that kids may be drinking things with caffeine or drinking too much amount of liquids within 2 hours or too soon, as soon as they go to bed. Also, make sure that you identify any key personnel information that may be going on or may be affecting a child that may be causing the bedwetting events. Any family events, are there any illnesses, has there been any deaths in the family, anything that's causing stress that might be impacting that. Also write down any questions you want to be sure to ask the doctor. He might discuss with you some alternative approaches to addressing the bedwetting. There are some instances where children might, because of a physical or medical reason, they may need or benefit from some medications. What type of treatment options are available if there is a medical reason for the enuresis. Talk about what the different causes are and identify what is occurring for your son or daughter. And also ask about when the bedwetting might stop naturally. Maybe there's a family history, and maybe this is something that is going to resolve itself within a few years, if they're 5 or something, and maybe they do have a bladder that's maturing later. And again, these are questions you want to have to discuss with your doctor. And then you need to be ready to answer any questions that the doctor may have for you. So besides everything you're bringing to them, the doctor may ask you some of these same things you're going to be asking, but also anything about the sleep habits, the eating habits, the drinking habits, any of these questions that the doctor might have for you when you actually have the appointment. There also may be some additional tests that might be necessary to determine the cause. Ruling out a urinary tract infection would simply be a urine sample, but there may be something beyond that, and you want to be sure and prepare your child for that. A lot of kids on the spectrum, we know, have difficulty going to the doctor, to waiting for things, to having anxiety related to medical procedures and things like that. So treating enuresis medically. The doctor may prescribe medications for calming the bladder to reduce contractions and increase bladder capacity, and this is something that would be diagnosed specifically by the doctor. There's also medications that may help change a child's sleeping patterns that could help with preventing the bedwetting. Again, this is by a doctor's recommendation and treatment plan. There is a hormone related to nighttime urination, and so if in fact that is what is identified as something that is a treatment need or option necessary for your child, that's something that the doctor would be talking with you about. And hopefully, if children do have some kind of a physical difficulty with the urinary tract or the bladder that does warrant surgery, then that's something that would be identified by the physician and discussed if that was the only option and if that was in fact what was the cause of the enuresis. Again, these are all medical treatments that are to be prescribed by a physician only. So we're not going to do anything at home to try to medicate or change children's sleeping patterns with medications unless we're under a doctor's treatment plan. So there are some different changes that you can do as far as lifestyle and home remedies. If your child has or possibly has an allergy to certain foods like fruits or dairies or some different things, it may be warranted to adjust your child's diet. Again, talking about what your child's diet is something you're going to want to talk with the doctor about too. But there is the opportunity to look at, is there any type of a pattern when children eat certain foods that those nights are the nights when they do bedwetting and things like that. And of course, as part of that, you want to avoid beverages and food that have any type of caffeine in the evenings. So you don't want sodas or snacks that have chocolate or have any caffeine associated with them. You also might want to consider, if this is a matter of a child who, is a very hard sleeper or is not getting up or not feeling that they're wet, consider a bedwetting alarm. And I'm going to show you a couple of examples of those in the next slides. You might want to encourage double voiding before bed. And voiding, of course, is the technical term for doing pee-pee, doing number one. So encourage double urination before bed. Right at bedtime, as we're getting ready, get in the bathroom, encourage to use the bathroom. And then maybe you're reading books or, they're doing something, and right before they go to sleep, we have them go back into the bathroom and go again to make sure that we've emptied the bladder. And we're prompting that because, again, your son or daughter may not be feeling the need for that, and we need to prompt that. Again, when you're first trying to work on encouraging kids to get up if they feel their bladder is full, if they don't feel it full, encourage them to get up at night and to use the bathroom. Of course, that means you waking up to get them up to use the bathroom, but it could start to help train that bladder to do that and to start going on some frequency, and also have good lighting so that kids can feel safe and see where they're going at night in order to get to the bathroom. You should also encourage your child to use the toilet during the day at least every 2 hours, especially if they cannot feel the need to go, they're not demonstrating that, and they are having accidents. You should at least every 2 hours just say, hey, let's see if you need to go to the bathroom. Let's see if, and encourage that because, again, that's part of trying to train the bladder to be able to recognize, to be able to, if it's full, and for the child to be able to, if they're not feeling that, for them to at least to be emptying that bladder and feel hopefully the difference between a full bladder and a bladder, where the urine's released. You also want to take advantage of some dry protection. I know a lot of families tell us like they've ruined mattresses and they're doing tons of wash, and it's not just time consuming, it's very frustrating. It can be expensive to have to wash, blankets and sheets and everything every day. So we would encourage you to take advantage of things like the plastic bed liners and sheets, also pads for the bed. And for some children, if they're 7 or 8 or bigger, they may not be able to wear a pull-up or a diaper or something with more protection. And so they actually make a lot of different types of the attends or the adults type of protection for that, because your child may be too big to wear something, or the wearing a pull-up or something, they urinate more than the pull-up is able to hold. You also want to know if your child is constipated. Again, we talked about that can be one of the issues. If your child is constipated, then there can be a difficulty in the bladder being able to be full or to stay intact because, in fact, the constipation is interfering with that. And ask your doctor about, should you use bran or, use prunes or some kind of fiber or something, unless the doctor said that, or it's been chronic constipation and you've had to treat it with something that is more of a laxative or something to actually relieve the constipation. Again, you should try to wake your child up every few hours to try to go to the bathroom, to try to implant that behavior. If you are using a behavior approach or earning reinforcers for staying dry, if the child is able. And the reason we say that is you can do sticker charts, and if you know that there is not a medical reason for why the behavior is occurring, and you're doing all the proactive things like having them go to the bathroom and not doing the caffeine and the chocolate and the other things, and you think that there may be something behaviorally going on of why they're, or even refusing to go to the bathroom. Sometimes parents are like, well, I can't even get them to go to the bathroom. And so you might be looking at that and using a behavior approach. Again, not negatives, because you really want to be sure your child is not having a medical difficulty, and that's why they are having the bedwetting. Okay, so some families we've contacted said, well, I looked online, I saw these alarms, and some of the alarms were almost $200. So we did a little bit of looking ourselves, and what we came up with is some less expensive options for the bedwetting alarms, and also that these can be bought in a drugstore or online. They don't have to have a doctor's prescription. So you can see here that these are called the Wet Stop 3, and this device is set to go off when the child is wet, and so the kids are not able to shut off the alarm and go back to sleep, because they would need to have that assistance to be able to do that. So it is intended to go off to wake the child up, and even if they started to urinate, then they would need to be able to get up and go to the bathroom to finish doing that. When I went online, these were less than $20. And then this is just a picture that they showed online about how to attach the alarms. The alarm is up around by the collar of the pajamas, and then the clip is, you can see the little drawing of the underwear under the pajamas. The clip is down in the area where if the child started to urinate, then the sensor would go off. Oops. Okay. Then again, we talked about doing some things. So, using some there's a lot of products out there using some bed protectors, because it's just too expensive to replace mattresses and to wash bedding every day and things, and it's frustrating. And then showing like either a smaller pad or like the picture on the right, there's actually a more fuller bed pad, so that you want to do things to prevent having damage to bedding. Okay, and then we talked a little bit about that there are some alternative treatments. What we know from looking at the research online is that there are some children who have responded to hypnosis with suggestion for using the toilet. And also it was noted that there appeared to be somewhat of effect from individuals using acupuncture. What we did also note is that there are other alternative treatments that do not at this time have any evidence to support their use as a cure or treatment for bedwetting. And those are noted at this time to be chiropractic therapy. Spinal alignment was not noted to be a cure for bedwetting. That a doctor would be someone, a medical doctor would have to evaluate what the medical cause would be of why a child was having the bedwetting accidents. There's more study needed about the diet. Again, there are some things, again, that children are eating or drinking that we do know. All of us, actually, as adults, know there's certain things that if we eat or drink a lot of, or things, or coffee, or if we drink sodas or teas or different things, we know that those are some things that can, increase our need to urinate and to urinate more often. And then homeopathic and herbs. There is currently no clinical trials that have been done supporting the use of those for the treatment of enuresis. These can be some difficult times when we talk to families and we're talking about potty training, and when people first register a card, no matter how old their children are, one of the questions we ask is, how are they sleeping? Are they good eaters? And then we get around to, how about are they toilet trained? Is there any issues? So we do hear a lot about kids who are not toilet trained during the day, and they're also having some bedwetting. But there's also the children who are toilet trained during the day, and they are having these nighttime bedwetting accidents. So that's why this presentation was put together, so that parents could look at and could get assistance and support from their medical person and others to determine, does their child actually have a medical reason? Is there something going on physically that is preventing it? And getting the support for determining that. So one of the things we want to stress is be patient and be sensitive to your child's feelings, because as much as we are getting aggravated or feeling frustrated, our kids are actually the ones who are feeling the embarrassment, who are feeling the sense of inability, and especially with kids who are not able to control it, that they don't have any control over what's happening. So anytime there's good things and kids are staying dry and they're helping, you want to celebrate those efforts. Punishment or making fun of kids, saying, you're, only babies pee or things, and making sure that other siblings or family members and things are also refraining from that. You do want to enlist and request that your child does help in cleaning up, because that does help in establishing maybe some control over what is happening. And so not as a punishment, but just as to let them know, I'm here for you. Let's do this together. We can change the sheets, let's check your alarm and see if everything is working, and how that's going. You also want to plan for an easy cleanup, keeping extra pajamas and bedding handy, because if these are things that are occurring and we have not addressed it yet, we're going to be up in the middle of the night or first thing in the morning, we're going to be dealing with this. So try to have some plans. I know a lot of us keep our extra sheets and blankets, and things like that in our linen closets and things like that. But you need to go ahead and have some supplies ready, so that you can just do a quick change out. You also want to use your resources. So online we found there was a lot of DVDs that talked about the different things that we're talking about today. There's a lot of books, there's a lot of literature out there about enuresis, about behavioral approaches to children who are not having medical reasons for the bedwetting, but actually more of a behavioral approach to it. And then also seeking medical assistance if the things that we've talked about today are things that you have noted. And even overall, if you've been trying everything that you feel should be working but is not, to make sure that you do seek medical assistance. And then also here at CARD, those of you may already have used social stories and are familiar with them. But social stories are things that we help for families to create around individual needs, such as potty training, going to a new school, really anything that is an event or an upcoming event or something behaviorally that you want to try to work on. Here I've just done one of the pages out of one of our potty story books. And so certainly if you're going to be, if you know that your situation is more of a behavioral issue or even helping kids learn about when to go potty and things, then your CARD coordinator will be more than happy to talk with you about that and develop a personal story for your son or daughter. And then also we have our parent support groups and other parents who are always a great resource to talk to about some of the behavioral strategies or different things that they've tried, and knowing that you're not the only person or family, that is going through this as a challenge. Okay. So what I would say is I'm going to ask if people have questions. I can't answer individual questions about your son or daughter. That's something that you would want to talk with your CARD coordinator about. But I can answer questions about the information that we presented. I also want to say make sure that you contact us. There's the telephone number, the website for UCF CARD, and our phone number. And also, I've added us to the slide here that our 24th annual conference for the statewide Centers for Autism is coming up in January. We're going to have a great conference, and I hope that we see you all there. So at this time, I'm going to go ahead, and if you all have questions and you want to enter them in the chat pod.